Hello, listeners. Thank you for tuning in to another episode of All Things Skin. And today we are talking wellness. I have my lovely PA, Savvy King, here with me. Savvy is brilliant, and we're so glad to have her on the team because she is really helping me, really bring this whole weight loss thing to all of our patients at Premier Aesthetics. We're super excited about it because, as you guys know, the skin is the body's biggest organ. And if you're not healthy internally, if you're overweight and you're metabolically resistant, if your hormones are starting to really fail, that's going to really make huge changes in your skin. And if we're not, using the right supplements, really enhancing, the skin health with the right vitamins, then we're just not going to really get huge results that we want.
Right.
So in addition to the skincare and all of the laser procedures that we offer, we just felt like wellness that is really geared toward total body health, total body wellness is going to do nothing but give our patients the best results that they can possibly get.
Totally.
So welcome, Savvy.
Thank you for having me. I'm excited to be here and chit-chat about all the things that I do alongside you.
Well, you're doing great. Our patients love you. I get great feedback from people all the time about what your bedside manner is just amazing. And we've gone to a lot of extra training, which is something that's a little different. You see everybody popping up offering hormone replacement and everybody kind of offering semaglutide treatments and weight loss treatments. But you don't see a lot of people doing a lot of advanced training. And I think that was something that you and I found, we really want to set ourselves apart by having that advanced training. So
for sure.
We both got board certified through the Hormone Health Institute to treat patients with bioidentical hormone therapy, also thyroid and other hormonal issues we can address as well. And we feel super confident that we have the latest and greatest in education to really be giving people the results that they need without giving them more than they need.
Yes, definitely. I would say both you and I take a low and slow approach to things, which I feel like a lot of my patients appreciate. My general mantra, I tell my patients this all the time, less is more. If we can, get symptom benefit and maybe the weight loss goals that you want or the reduction in symptoms that you want with using, lower doses, then that is always going to be my mainstay. I find that people generally just fare better on that sort of regimen in regards to side effects, long-term, efficacy and just long-term maintenance of things when they, we're not overdoing it. We don't need to overdo a lot of this stuff, I don't think.
Right, I agree. And, we've seen some patients that have come to us, from other providers and things like that, and no negative to other providers, but a lot of these patients are on super, super high doses of testosterone, which actually can be really dangerous. It can actually make your hemoglobin hematocrit go up. It can increase your risk of stroke.
Yes.
So, doing too much too fast.
Yes.
I agree. I just don't think it's good for patients, and I think patients are really looking to people that have the education that want to really sit down and create a customized plan. And it's not cookie cutter. Right. It's so different for each patient and their history, and the medications that they're on, where they are, in their hormonal journey. But it can make such a huge difference for people. So tell us a little bit, our listeners, what are you seeing from our clients that have started with bioidentical hormones, and what have you started them on? What have we seen the best results with, and that kind of thing?
Okay, so I have patients all across the board. I would say we have inherited some patients who have been doing hormone replacement for 20 plus years.
Right.
A lot of my patients, I would say, they have never done it. They, oftentimes are peri or postmenopausal women. Obviously, that's the most common patient that I'm talking to. Which is interesting because a lot of times the hormone and weight loss discussion is kind of going hand in hand.
Right.
Like we're doing, not just one thing, but a multitude of things to address issues. With hormone replacement therapy, I know Dr. Clifton has done an episode talking about what we do and kind of our process, so I don't want to beat a dead horse, but We focus, again, everything we do is bioidentical. The two main, modalities that I'm using are going to be pellets or creams, okay, which I think can have their place in each different patient.
Right.
Across the board, the mainstay benefits that I'm seeing with my patients with estrogen, with estradiol, the hot flashes and the night sweats is a huge one, huge reduction in that. Mood stability, improvement in sleep, vaginal dryness. Those are probably the things I'm hearing across the board. The interesting thing about, menopausal symptoms is somebody will ask me like, oh, well, could this be a menopausal symptom? I would say like 90% of the time the answer is yes.
Yes. Menopause makes you, it's just not good for your body.
It bleeds into so many different, organ systems and things. So, just about anything can be related. With testosterone, I'm seeing a lot of improvements in a bunch of different symptoms with my female patients, which, we generally view testosterone as a male-only hormone, but that is not
all
true.
Women have it,
we
right?
make that in our
absolutely.
ovaries and in our adrenal glands. So when we go through menopause, or even before that, when we start to age, we are, reducing our production of that. So I have patients who, are not fully menopausal, and maybe they don't need estrogen yet, but we are replacing their testosterone. And oftentimes the main things I'm hearing improvements on that front would be libido, energy. Another one that people usually are shocked about is like joint aches and pains. They'll tell me
difference.
like, oh, I didn't even know this was an issue until it like was gone, right?
Yeah.
So that one's more of a, sometimes I feel like, shocks people.
Yeah, and also preservation of muscle mass.
Yes.
Preservation of strength.
Definitely.
Rebuilding of muscle mass, that gets lost so rapidly.
Right.
Within the first 10 years of menopause,
Yep.
so many bad things happen. So if we can really, kind of change the overall view of menopause. I think so many gynecologists still just view menopause as that's just a normal thing. Women are just supposed to go through menopause.
Right.
But I personally, after going through menopause, I call BS on that.
Yeah.
I think if women don't address the loss of these hormones over time, what happens? We have bone loss.
Yeah.
We have muscle mass loss. We have dementia. Hormone, reductions have actually been linked to increased risk of all types of dementia. So it's cardiovascular issues. Women become much more at high risk once we lose that protective estrogen.
Totally.
And, even women that have had breast cancer or other cancers, sometimes there's a benefit to having very small doses of, even progesterone or testosterone for those women, even if we're avoiding estrogen. So there's so many different ways that we can really tailor it to make menopause, not a thing anymore. It's kind of my mantra.
Yeah, that is a good mantra to have. Yeah, I mean, I'm seeing lots of benefits across the board. Again, as Dr. Clifton mentioned, with my patients' histories and with their other risk factors, I take those things extremely, seriously. I, talk to my patients' other providers, their oncologists.
Yes,
that they
I
have
love
a
that
risk.
about you, Savvy. You always make that call.
Yes.
And you're very collaborative with the patient and with their other physicians because this is a partnership.
Totally. And again, right, like you mentioned, this is something that maybe is getting, brushed to the side, or their other providers don't have the bandwidth to address. And if I do, then like that's what I'm going to do. And yeah, I am much more err on the side of caution and collaborate with my patients' other providers whenever it is necessary. I think, again, team approach is the best way to go.
Teamwork makes the dream
yes,
work. Absolutely.
For sure.
Well, and we're so careful. We're really doing this thorough screening process where we're seeing what any risk factors that anybody has, family history, all of that, in addition to very comprehensive lab draws.
Yeah.
Where we're really monitoring this stuff.
Right.
We're not just putting you on hormones and then saying, okay, well, we'll see you in 6 months or whatever.
Oh, no.
So that's what I love about it, is it truly is a partnership, and it really goes hand in hand. And as you said, it goes along with the medical weight loss.
Definitely.
So many of the women that we see, men too, so many of the women especially that we see are, perimenopausal, around menopause, that weight gain becomes a real thing.
Totally.
And it becomes very difficult to get it off.
Definitely.
And so talk to us a little bit about what you're seeing with our medical weight loss patients. What's their success look like? Besides just weight loss, what kind of success do you see?
that's, again, a good conversation to have. I mean, again, right, obviously, same thing with, like, medical weight loss, hormone replacement therapy. I feel like a lot of my patients, they get into this for short-term relief of symptoms, right? Like, they want to feel better, they want to look better, all of those things. But then the interesting part of that is, like, again, the long-term benefits that they're getting beyond that, or benefits that they didn't even know were possible, are kind of tenfold. Which is really interesting. With us doing medical weight loss, we are mainly focusing on GLP-1 agonists, which they are doing so many studies on and are every day learning more about these medications and how they work. They've been around for 20 years or more and used in diabetic populations, but the doors have really been opened in using these in different avenues for weight loss. I have patients who are of all different weight loss goals. Again, my patients who are obese and are looking to lose 50 plus pounds, and then I have other patients who are, again, maybe menopausal, and they're like, look, this 10 to 20 pounds will not come off of me regardless of what I do. Again, kind of goes back to the low dose, method that we talked about. Yeah. We're able to accomplish a lot with a little bit of these medications. So obviously,
that's a huge point, Savvy.
Yeah.
I want to pause you just for a second there, because I think a lot of these medications right off the bat, everybody got super excited, put everybody on them at this extremely high dose. That was how they got FDA clearance.
Right.
And as you know, in order to get FDA clearance, you have to show a statistical significance over a very short period of time.
Right.
So, of course, these drugs, if you give them really high doses, people are going to lose weight really, really quickly.
Totally.
But they're also going to have a lot of nausea, a lot of vomiting, potential rapid sarcopenia, or weight, or, muscle mass loss.
Yeah.
And then the other bad rap that you hear is it slows gastric motility. So if patients are undergoing surgery, those people are more at risk for aspiration. So I think there's been a lot of kind of negatives around these drugs, not necessarily because of the drugs themselves, but because of the dosage.
Yeah.
And I think a lot of patients are coming in and they're realizing that, you don't really have to be on these super high doses. And that's what we're really starting with people.
Oh, yes.
We don't want people to be miserable and nauseated, and certainly want to make sure that they're doing this along with good exercise, good protein intake, good diet,
100%.
So that those things aren't happening. So I do think that dose is important.
Yeah.
So talk a little bit about how you choose dosing for patients and what the goals are on that.
Well, I would say the front end answer is very simple in that I start everybody at the lowest dose, okay? Like, unless somebody is coming to me already on a GLP-1 agonist, and there is a need to, transition them onto a higher dose, like, I don't think anybody needs to start at anything higher than the lowest that there is, right? Because, again, if we can accomplish what we want to, which some of my patients can accomplish their goals on the lowest dose, then that's what I'm going to do. Again, I do tell my patients, look, that's not going to be everybody, and it doesn't mean that we're going to crank you up to the highest. Doesn't mean that you may need a dose increase or two, sure. And like, if we're taking that very slowly and we're monitoring your side effects as we go, and we're mitigating those where we can, and we're monitoring your lab levels, then I have no issues with increasing as we deem necessary. But it isn't always deemed necessary, in my opinion.
Yeah.
So again, right, the benefits, right? Obviously, what are a lot of the benefits? It is the weight loss, but they are, again, every day learning more about these medications, using them in, like inflammatory conditions, right? Like any sort of inflammation that you've got going on, obviously specifically with your gut, using these medications and like IBD. I do have patients with a history of like Crohn's or ulcerative colitis.
Irritable bowel, any of those things.
Who are using these meds and are finding, no, they are improving. They are reducing my flares. They are reducing my internal inflammation.
Calms down the inflammation, yeah.
Which makes sense, right? I mean,
well, and it's, overall, if you improve someone's metabolic health, right, you're going to improve everything in your system.
Totally.
Inflammation that leads from metabolic dysfunction is sort of the root of all evil. It's the root of almost the cause of cardiovascular disease, the cause of cancer, the cause of dementia, the cause of arthritis.
Yeah.
A lot of inflammatory skin disorders are really linked to inflammation.
Yeah.
So if we can use these drugs appropriately, and help patients manage their weight, their metabolic health, and their inflammation, it can be a game changer for them.
I know. I think that, again, with medical weight loss, it gets this, notion that it's a vanity thing and that it's just so that you can, look good in the mirror. But I would argue that that's like a plus, right? Feeling good in your skin is a positive benefit, but my goal with most of my patients is going more so, again, for their long-term health, right? Improving their cholesterol levels and their blood sugar. Like, I mean, I see that on lab work all the time. And again, right, losing some weight is going to reduce, muscle, or like reduce inflammation on your joints and the amount of pressure you're putting on. So people can really use these medications also as a catalyst, right? If they already have some healthy, lifestyle habits in play, awesome. But sometimes finally seeing some benefit and some relief makes those other things that you want to do, like, more feasible, right? The exercise and the diet aspect of things too.
Well, and in addition, we're not just looking at hormones. We're looking at B12 and vitamin D and cholesterol and liver function. We're looking thyroid function. We're looking all across the board. And we're also helping these patients with supplements.
Yes.
Like DHEA, that helps to stimulate production of their own natural hormones.
Right.
B12, vitamin D, other anti-inflammatory things. We've just brought on this really cool, really interestingly named new supplement called Fatty 15. That is the first newly discovered essential fatty acid in over 90 years that we're going to actually talk about on a podcast as well. So tune in for that, called Fatty 15. And we're bringing on peptides that are going to be helping people, maintain that muscle mass. Really do everything from increasing sexual health to libido to all of the different things that peptides can do. So we're really excited that we're not only helping people lose weight, but really helping build their overall health.
Totally.
And one thing I'm really excited about is my daughter is actually partnering with us. My very brilliant oldest daughter, Allie Clifton, as many of our listeners know, has finished her master's in nutrition and biochemistry. And she is a certified health coach, and she is going to be part of Team Premier.
Totally.
And she's going to be helping us, all of our wellness patients, our weight loss patients, anyone that just wants a little diet assistance.
Totally.
She can give you just everything from just a baseline overview of things to help. She can help with exercise planning. She can actually create full meal plans for people. It just really is going to be tailor-made to whatever the patient wants. So I'm super excited, not only to have my daughter as part of the team, but I think she's going to be super valuable to helping our patients really reach their goals.
100%. I'm excited to have her work alongside some of my patients too. I mean, weight loss or not, like, either if they are on these medications, or even if they aren't, I think that they could provide benefit, because I definitely do talk to my patients who are on these medications about their diet and their exercise, right? And as a PA, I know about some of these things, right? I know the baselines, but I'm not a dietitian, and I don't have training specifically on nutrition and food and those sorts of things. So having someone else to help my patients, like, more specifically on that front, I think is going to be really, really, really helpful for people who, maybe do or do not know, like, what should I be eating or what should I be doing.
I mean, most people probably know what they think is healthy. But when you're really going through this process, especially when you're on a medication to help you lose weight, you really want to make sure your macros are right. The level of protein is super important.
Totally.
And I would say a lot of us don't get enough protein.
No.
And especially if you're going to be on one of these medications, that's uber important. So I'm excited about that whole partnership. So we're doing this whole team approach, as you guys can tell. I'm actually getting a third board certification because, as all of you guys know, I'm an uber nerd. So I'm getting a board certification in anti-aging and integrative health. And we're going to go to a conference together in December. I'm actually going to do my oral and written test there so that I can be board certified. So stay tuned on more of that stuff.
Of course.
But before I let you go today, Savvy, there's one more part of kind of the overall wellness picture that kind of has always been a part of dermatology, but that sometimes people don't really think that it's in the realm of us. But hair loss is a huge thing.
Totally.
Yeah. And what we see, a lot of these patients that are losing weight really, really quickly, if they do it too quickly, that could shift them into something called telogen effluvium, and they can start losing their hair. As we know, as men and women age, if they have the genetic tendency to have androgenetic alopecia, then the hormone switches are going to lead that to happen.
Yeah.
And so sometimes as we're replacing hormones, we also need to do medications to make sure that we're, reversing their hair loss or helping certainly not make it worse.
Right.
So we've got some really cool tools.
Yes,
So
we
let's
do.
talk a little bit about a couple of them.
Okay.
The first one that I really, really love is the hair metrics.
Yep.
Because it's a test that we can use it tells us exactly where the patient is at baseline, and then we can track it.
Yes.
So talk for our listeners a little bit about how we use that tool and how it works.
Okay, I describe hair metrics to my patients as a very, very fancy and close-up camera of your scalp that gives us quantitative data about your scalp, hair, follicle health, right? Because when we're talking about hair loss, people are going to know, right? Generally, they're like, oh, well, I think my hair loss is getting worse, or I think it's getting better, based on what they see in the mirror and how much they're losing in the shower and, things like that. But having actual numbers to tie to that is really important to me, just to really know, okay, like, are we seeing improvement or are we not, right? Outside of just what the patient can notice on a baseline level. So essentially, it's, again, a camera that we use in our office that gives us data on the width of the hair that we have on our head, which is, a determinant of its actual health, right? The phase in which it's in. It looks at how many follicles per, surface area on your head to know, also tells us like how many hairs are coming out of each follicle, because each follicle can have more than one hair. So it essentially is a good baseline measurement before someone has ever started a hair loss treatment to know. But it's also something that we use as a metric as patients are going through whatever sort of, treatments that they're using, to know like, okay, what are we seeing? What is the data showing that we're showing benefits for patients. So it's really cool. Sometimes people are grossed out because it gives really close photos of your scalp and they don't like seeing it, but they are also like always really intrigued when I go through the numbers with them, and they're like, oh wow. And it's just, that's kind of what it is.
It's so really, really rewarding too when people come back, 3 or 6 months later, and we actually can put those numbers right in front of them. Because they can say, yeah, like you said, oh, I think it's a little better. But when you can actually show, look in this square centimeter.
Yeah.
6 months ago, you had 120 hairs. Now you have 190 hairs per square centimeter. And in that same square centimeter, not only do you have more hairs, but the cumulative thickness of the hairs is maybe double.
Yeah.
So it's like this, oh, wow, okay, this is actually working.
Yeah.
Or, you know what, maybe the medications I'm on are not working.
Yeah, or it's not.
And, we have a lot of clients that come in and they've maybe taken some supplements. Maybe they're on Nutrafol, which we love and we offer and we recommend for our hair loss patients and really a lot of our patients. Great supplements. But, if you're not seeing the results you want, there's a great way now for us to determine what should you be doing. So that's why we have the Tricho test.
Yes.
So let's tell us about the Tricho test.
Okay, so the Tricho test is essentially it is a genetic test that is used to better guide and pinpoint what hair loss treatments people should be on, right? As Dr. Clifton has talked about a lot of times on her podcast and on your Instagram, there are a lot of different types of hair loss. And a lot of times I feel like my patients have a whole slew of things that are contributing to their hair loss, right? Maybe they have an underactive thyroid. Maybe they just had a baby. Maybe they this, and this, okay? It's not always a clean cut, oh, well, this is the one cause of your hair loss, so we need to fix that, okay? So we have a lot of very commonly used, medications for hair loss, Rogaine, minoxidil, Propecia, these things. And for some people they can work, but sometimes genetically you are not inclined to respond very well to all these different medications that we have. So this is a genetic test, so it's a buccal swab, a swab of the cheek that we do in office, that we send out to their lab, and it looks at 49 different SNPs, single nucleotide polymorphisms, which are essentially just little splices of your DNA. And it shows per those different, pieces of DNA what medications are going to help and what are, probably not going to hurt, but probably not going to do a whole lot.
Right.
I find it helpful for my patients who have never been on anything, who are like, look, I don't want to waste my time. That's the unfortunate part of hair loss treatments is even if they do work, and they might, we're not going to see benefits for 4 to 6 months. So it's like, we may be using something and we may be wasting your time, right? Like that often happens. Versus, again, some of my patients who have tried multiple different things, it's even more helpful for them because they're like, oh, I know this didn't work and I know this did. What do I do from here? And it's helpful to, again, guide treatment. So We use that data in office a lot of the times to, essentially save our patients time with dealing with hair loss treatments and use the thing that is actually going to work as opposed to the thing that may or may not.
Absolutely. Takes a lot of the frustration out of it.
Yes, it makes our job easier.
It makes our job so much easier.
And
I love it.
It makes our patients, lives better also in regards to knowing that they're doing something that actually has a fighting chance of helping them.
Well, and some of these medications are not even covered by insurance, so you could just be kind of throwing money into the wind if you don't really know what's going to work for you.
Yeah.
So I love that. I love that as well. And, we're always on the cutting edge. We're trying to bring to all of our patients the newest and the latest and the greatest things. And, PRP is marginally, it improves, hair loss.
Yeah.
But it gets, doesn't work as well if you get older.
Yep.
Some people don't respond as well as others just based on their general health because you're drawing their blood, spinning it down. So if the person's not ultra healthy anyway, the growth factors in PRP is not going to be very helpful. And if you're over 35, you're probably just not going to have a lot of growth factors. So that's we kind of don't do a lot of it anymore unless you're really young. But we do have a new injectable treatment that is pure platelet-derived growth factor. So it's only the most powerful growth factor on the planet. It's been actually genetically created out from taking the DNA sequence of it and putting that into yeast cells and growing it and then stripping away all the yeast cells so that you just have the pure platelet-derived growth factor. And you can use that topically after microneedling. You can do it injectable for hair loss. And we're starting to really see exciting improvement with that. So we're always on the cutting edge. We're always trying to bring the latest and greatest. And Savvy, I just appreciate your partnership.
Oh my gosh, you're so nice. I have loved doing everything, working alongside you and having your guidance and your expertise has been, invaluable to me and, all the things that I do with my patients as well. So,
well, we're having fun. It's great working with you. And so, listeners, if you're having any of these issues, from hormone changes to needing some, medical weight loss, or maybe just checking to see, where you are, what kind of supplements do you need? And certainly, if you're having any kind of issues with hair loss, we are absolutely here to help.
Yes.
So please tune in to further podcasts because we're going to be talking even more about some of the peptides and some of the supplements that we're doing. But please come into Premier and let us have a complimentary consultation with you.
Let us help you.
Yes. Thanks for tuning in to another episode of All Things Skin.